We are live, and then let me just. And you can kind of motion me when you want me to change the slide. Yes. All right, guys, we are ready to start.
Hi, everyone. Hi. Thank you so much for coming tonight. Everyone got a seat? Awesome. Okay. Cool. Well, I'm Dr. Bakker. I'm the newest addition here to the FloridaWild family. Very happy to be. And I'm going to talk to you guys about one of our diagnostic options today, and it's called DigiTherm, which is a really unique option here at FloridaWild. It's not used in many hospitals, kind of one of the ways that we stay above the curve of what we can offer you guys. All right, so DigiTherm is the brand name for a tool that does digital thermal imaging. And essentially, it allows me to take a series of photos of your pet and see their entire body's heat map. And this is really helpful for measuring any sites of inflammation, areas that are hot or areas that are cold on your animal. And it's a really good complement to a physical exam because, of course, traditionally in a physical exam, doctors use their 5 senses, right? Well, mostly 4 senses. We try not to use taste. But as far as, you know, what we can feel and hear and see, we get a lot of information. But, you know, dogs and cats, any animal is especially talented at being vague in what's going wrong with them. And I know as an owner myself, and as I've seen with many clients, sometimes all we know is, you know, our pet just isn't feeling quite right today, and there isn't a clear problem. And this is where this can be very helpful. All right, so, you know, occasionally we get a little lucky. If our pet's going to have to feel bad, they're very clear about why. But most of the time, we have to use diagnostics to solve the puzzle that is our pets who can't clearly tell us, don't speak English, and don't quite understand what's happening, so we can find out what's going on. And with DigiTherm, especially with musculoskeletal problems like our bones, our muscles, any source of pain or arthritis, we can scan the pet and actually see, oh, look, our knee is what's angry today, or both our hip and knee are a problem. So it helps us to take the I'm generally uncomfortable to right here is where I need to treat. The nice thing about it is that it's non-invasive. You know, this is a test that we can do without having to cause any stress to the animal. And it's so precise that it really helps guide our treatment plans. One other nice tool when we have kind of a case that's going to come in multiple times, someone who we're trying to improve their comfort. Say we have our old dog who has arthritis in their hips, and I might scan them and see, yeah, our hips are really bright red, so red that they turn white. White is the hottest color that we have. I can then use acupuncture, laser therapies, potentially medications to help with comfort, and at our next recheck we can see that there's been progress. In this example, this is a dog who had hip arthritis and stifle arthritis, and about a month after instituting therapies like laser, you can see that the colors have changed dramatically for this pet as far as their comfort and their sources of inflammation. So we can actually monitor our progress and not just assume it's working. So the physiology behind it is pretty simple and gives us a very direct answer, and that's because when we have injuries or any angry area within the body, we get inflammation. And the body has a lovely cascade of events that happen once inflammation starts. But these include bringing forth a lot of enzymes and angry mediators that say, hey, immune system, come over here, I'm upset. And when all that happens, we get inflammation and swelling. Part of that reason is because blood vessels get larger and dilate, and they go there, and our blood is warm. And so that's what DigiTherm is able to see. That's where that heat signature comes from. When I have, you know, a painful spot and it flares up, you've probably experienced touching an injury and it's hot to the touch. This camera from our DigiTherm machine can actually say, oh, that's not normal skin temperature. That's actually an injury. That's too many blood vessels. So it's really cool. So I have a few cases to show you of examples where this has been really helpful to track things. So in this one, we had a dog who fell off of the couch. And once that happened, this pet was very, we'll say, awkward. You know, didn't really know how it wanted to stand, and was very vague on its physical exam about which part was more painful. And they had to take x-rays, and they also used DigiTherm to kind of complement each other. So on the x-ray, we could see that this dog's spine was actually curved, and the spine itself was uncomfortable. On the DigiTherm, you know, despite this dog having a long hair coat, we were still able to see that at the areas where the curve of the spine was, we had more red inflammation. And so this dog had chiropractic adjustments to help with its spine. And we can see after how nice and straight things are, and complement that with the proof with the DigiTherm that our inflammation was practically gone. Now, one thing that was nice for this was, yes, we'd done our treatment, but the DigiTherm allowed us to see there was still one spot that was uncomfortable. And so with a few laser therapy treatments, they were able to resolve that as well. So it allows you to be very comprehensive and stop taking the guesswork out of, are we helping? This one was quite amazing. We had, not we, but this company had a case come in where they were monitoring the hip and knee arthritis, and we can see this dog is having a bad knee week. But on this particular DigiTherm day, they also found an area that had not popped up before for this pet. And when they went back and looked more carefully, they found a mammary tumor. Now, cancer is another form in the body that recruits blood vessels and says, hey, let's get hot. And so it can occasionally be screened using DigiTherm. This dog, they were able to then remove the tumor and check regularly with DigiTherm. The histopathology from that tumor said it was gone, perfectly cured, and it didn't come back, and this went back to normal color. So, you know, interesting tool that can be helpful in multiple ways. In human medicine, the big hot topic right now for DigiTherm is mammary cancer. There's a lot of research studies looking at, can we use DigiTherm to complement or sometimes in place of mammograms to screen, because this doesn't have any radiation, this doesn't have any side effects. So it's an interesting area that we're going to keep studying. And this kid, here's another poor hip arthritis dog, as usual. It happens to the best of us. But this patient was also having just some uncomfort on his exam right along his spine. And when we did DigiTherm, it was a very particular spot. It wasn't just general muscle aches. So this was a case where just doing regular screening with DigiTherm showed us a hot spot that we could treat. And they went ahead and did laser therapy precisely where it was needed and resolved it. So. The other side of DigiTherm is it's not all about heat. It can also be about what's cool. When we have areas where there are neuropathies or nerve diseases, often you also have a shrinking of blood vessels in those areas. As the brain stops telling, you know, a nerve in the leg to stop firing, you're getting a lot less feedback from the body that says, hey, keep me warm, keep me comfortable. And that results in a cooler area. Now, it's not necessarily something you always feel to the touch, but one good example is Raynaud's syndrome in people. If you've heard of this, it's where you're extra sensitive to the cold. And these people who are affected, they don't get good peripheral blood flow. So even in like 70-degree weather in an AC building, their fingers can turn blue because they're so cold. And so this is a patient who has that, and you can see the heat signature, but as it goes further out, there isn't as much blood flow. And here we actually have a horse. These are the back legs of a horse, and who was coming in, and they kept trying to work up for soft tissue injuries. You know, was it the muscles? Was it the tendons? Tendons are horrible in horses. But using DigiTherm, they could actually see that it wasn't just soft tissue alone. There was a nerve component that had been damaged and was resulting in this entire lower peripheral limb having decreased sensation. So it was very helpful for them diagnostically. So who can have DigiTherm? It applies to everyone. all ages, but particularly our geriatric cases would be the first one that I would jump to. You know, we know that our joints change as we age. We can't help it. And I like the idea of having DigiTherm be part of an annual physical exam for some of our older kids. You know, the same way we would screen with blood work, we can do DigiTherm and see if there's any areas we need to be treating for discomfort. But it is especially helpful in cases where we have acute injuries to help localize the area, as well as for maintenance. So if you have an athletic dog or a sport dog, you know, who isn't necessarily limping, normally after their big events, they are sore and they have aches, and we can target where we need to do laser therapy, and that can really help them to stay top athletes. But, you know, if your pet at home is showing any evidence of being sore, limping, sometimes it's behavioral changes that give away that they're uncomfortable. This is a good thing to recommend to your veterinarian that you're interested in. Okay. So we have the DigiTherm here that I can show you guys as an example. But one of the things that's really important for us when we do this is that it will make an exam with your veterinarian a little longer. One of the rules for doing DigiTherm is that no one can have touched the pet for 30 minutes before the exam, because your heat will actually stay on them that long and can affect the imaging. So we like to have our patients just relax, no pets, no cuddles, and then when we are taking the images, we have to wear special gloves that hide your heat signature for the camera. Let's see, if you go to the next slide, I did my dog Poe the other day, this handsome mug. And, you know, whenever we start doing DigiTherm, the first thing we take a picture of is the face. And that's because one of the hottest and coldest parts on the body are the nose and the eyes. And this helps the camera regulate. But what's cool is that, you know, we're not just casting a generalized heat gradient for your pet. It's specific, it's specialized. The camera measures, know what is your pet's heat gradient, what is the coldest and hottest for you, and makes a custom image. So it's very personalized treatment. We get a whole report. You can go to the next picture, but of many areas throughout the body. And one thing that I didn't know about my pet before I scanned him for my healthy example is that he actually has, you know, these areas of yellow and these little bits of red here and here. The groin is normally very bright red. Don't mind that. These little spots are up in his, you know, upper arms and his shoulders. And if you go to the next picture, it was confirmed again in other views where against his little arms and his shoulders, he had little bits of yellow and red popping up. And if you think about it, it makes sense. He's a bulldog. He puts a lot of weight in the forefront. But I hadn't thought at 1 year old that he was dealing with any kind of discomfort from that. And now I know better. I'm going to consider doing some laser therapy for him once a month and just trying to keep him in a nice maintenance and set him up for success, right? Instead of waiting till we have injuries. So that's my boy. But do you guys have any questions before we play? No? Awesome. So we have an example here today. Would you like to introduce your baby?
This is Doc. He is a 6-month-old otter hound.
You are very handsome boy.
I know, that's right.
Yeah, it's going to be something long.
Good boy.
Yeah, about 150 pounds.
That's part of his charm.
Okay. So I'm going to show you guys what we see. All right. Help if I take the cap off. Okay, so when we start, the camera has to correlate, right? So we start in black and white, and we tell it where to focus.
People on the internet.
And people on the internet? See, Doc? There's a dog in here, believe it or not. But so, we're able to kind of correlate it to him, and then I pick rainbow. And now we have a lot of colors. Now, it's just, oh, there we go. So now I can use it diagnostically. So the camera actually focuses. If you could look, well, I can have any part of you, Doc, I don't care. So right now, it's very blurry, but I can focus the camera so that we can actually see his individual hairs and areas. And when we do that, like I can see right now, his tail is much hotter at the tail base than the rest of it. And our right back leg, I got this. His right back leg is more red than his left.
Yeah.
So these, are just little clues that are unique to him that we can then say, hey, well, Doc seems to be doing well. Could he use a little bit of supportive care before we get to a point where he's uncomfortable? That are why I like this tool as part of a normal, appointment, a normal annual physical exam.
Will you touch him and show how it affects the heat signature? It's kind of crazy.
Yeah, let me rub your head for a
Depends on how
minute.
warm you are, I guess, too. I probably won't affect it at all.
Put your head over here. Yeah, I know, you have a lot of fur. The longer the hair is, the less of an impact.
Yeah.
But yeah, now it's red on top of his head. Before it was green.
That's the biggest issue with doing it in practice is you have to think of doing it.
Here, let's try to show them.
Yeah, so sometimes we'll talk
I
about
think
the
at least what I'm
It's starting.
We do it as they come in the door.
See?
to try and
No,
get
it's too bright.
maybe if I.
Yeah.
No.
Yeah.
Oh, wow.
Because we can
This is
definitely-
Doc. He's a good boy.
So, Dr. Bakker, could
Yeah.
you
But they grow super fast. Could you screen for pano before it became a severe thing possibly with DigiTherm?
Screen for what, sorry?
Pano?
Yeah, absolutely. Absolutely. But it would be something that you have to check kind of regularly,
Yeah.
right? When an inflammation of the bone is going to pop up, I don't necessarily know which day that's going to happen. But it's something like coming in on our regular when we're coming to get our vaccines or popping by for that fecal. It'd be interesting, especially in giant breed dogs, to scan their legs and see how their comfort is doing because, man, we all know as people growing pains are a thing.
Yeah,
So
for sure.
we could help.
So the scans are kept and then, especially with a younger dog, you can kind of form a baseline and then see the changes over time as well.
Exactly. And that's why, Doc has some heat in his one leg right now, but Doc isn't limping. He's not uncomfortable. So that's kind of the beauty of it is I can find out what's normal for him right now. And what does he tolerate? Do I want to help? Do I want to do something? Is there acupuncture? And go from there. It's just a good way to help manage them since they're so good at hiding discomfort.
Someone online wants to know, will this be part of the regular exam?
It is an option. I would like to offer it for any of my normal annual exams. I believe our charge to do the full exam with DigiTherm is about $40. So it's a very reasonable addition to be able to get a good heat signature on your pet.
Charlie's got that indent on her muscle. Would that help to see what, because we didn't know when she first came in with it, what it was, why it was, and it's getting deeper.
Yeah, it can definitely help to speak to the acuteness of it. Is there inflammation, or is it muscle atrophy? We can feel that indentation, but is there something hot and inflammatory that we want to use laser to quiet down, or is it more atrophy and something that those modalities aren't going to help as much? It can help to direct our therapy for sure.
Because I know when I rub her, every now and then she'll go, and she'll just try to push me away with her back. And is it tender? Is it tender because she gets her rubs weekly,
Right.
Saturday, Sunday especially. We take 20 minutes every morning, just go through and I rubber it completely, just to feel anything, is anything different.
Yeah.
We do our stretches, I pull her legs, just kind of.
Yeah, it's definitely helpful for that. And I think that, we all had at one point felt like, well, like we are the kind of doctors that want to put our hands on our patients and feel for heat and feel for cool and feel for those things. And we spend a lot of time and put a lot of emphasis on our exam. But we live in Florida, where sometimes they come in hot, or or it's their environment and their situation can affect those things and sometimes impact our ability to assess them just with our hands. But this gives us a much more clear sort of heat signature, and we can follow it even on serial exams and see, if we're seeing a consistent heat signature. This is something that's real that we need to do more about that.
Would this show the deepness of it compared to the first time I brought her in, where I'm thinking it's getting deeper? Maybe it's mom.
Yeah.
It's mom being.
It's not exactly, it wouldn't be good for measuring depth. Like, I wouldn't say that, I could use this to see how hot an organ is within the abdomen. But it is something that, when we're looking at the surface and how it's radiating heat, if we did that, say, at your, next visit, and then we did it again at a follow-up, you could see how that's changing. Sometimes things, if it was, going deeper or getting less significant, it might calm down. But like Dr. Schrader said, it could be good for guiding therapy. Is this area inflamed or not?
It's
If
right
it is,
in,
maybe infiltrate it.
correct me if I'm wrong, but it's right in the muscle, right above her back, right leg. Her left side. But it's like, I noticed it's starting to, kind of feel funny, and now it's getting to me, it's getting deeper.
Yeah.
From when I originally brought her in, when we couldn't figure, it's just.
Right, another kind of a vague situation, yeah. No, it could be helpful for
That
guiding
was
our
almost
next
a year
steps.
ago, so.
I think that'd be appropriate for this. Okay. Great. Well,
Okay, I have one more.
yeah, of course.
So it's a good precursor to seeing if we should do additional therapy. Because like my Bailey, he's like feeling he's a little off again. And so I'm like,
Okay.
does he need another round of acupuncture maybe? And so it seems like something like this might help us to see if maybe that's a direction, to see if that's a thing or not.
Absolutely.
Maybe.
And it's a good complementary tool. So between your physical exam and
Right, try to
adding this
decide.
on, especially if we're thinking about comfort, this could definitely help guide someone's therapy in choosing acupuncture.
And if you have a dog that's like a hot dog anyway, Kaylee, it's a hot
Yes.
dog, it's a wood dog. Does
That
that, does that affect the reading?
Well, so that's what's so special about this camera. When you focus in on the patient and I measure the face, it says the coldest that this pet can be is right on the nose. The hottest it can be is about the eyes. And then it creates that color spectrum. So that color spectrum is just for your pet. So if you have that hot, hyper Labrador, or, we've all met those dogs, that are, man, they could even be hard to examine because they're so excited and so happy. This can be a really nice way to take the subjectivity out of things and just say, hey, let's measure. Let's get an actual measurement.
Right, so it's like, is it me? Am I overboarding?
Mother.
It's a delicate flower.
And this is a it's a non-invasive way for you to treat it.
And it can guide us with acupuncture too. Acupuncture there's a lot of points that we pick based on their constitution and what they're showing us in terms of their balances or stagnation that day. But then there's also just local points that we choose. And local points are going to depend on where they are, where they're having trouble. And this is something that could certainly impact our choice about local points. Especially, if they're jumping around and it's hard to
Exactly. If they're
hard to
happy-go-lucky.
feel like, oh, it's a little over here, and then
Stop,
somehow
sit down.
that can be hard to gauge sometimes.
Sounds cool.
Yeah, I mean,
I'm ready to try.
it's non-invasive. It's not going to hurt. Could only help. Yeah, so I'm a fan. All right, guys.
Doc's still in the show here in the middle.
Yeah. Any other questions?
Nope.
Good to go.
Okay, what can you use this on a dog with neuropathy down the back?
Yeah, in general, whenever we take a series of images, we take the front of the dog, we do different sections of the legs, different sides of the body from behind, and different sections along the spine. So it's a complete body check. We never just, do one spot. And so in looking for that, we could see, especially like in short-haired dogs, it's even easier, but regardless, you can see heat signatures or cooling in the spine.
Perfect. I think that's about it.
Fantastic. Well, thank you guys.
Thank you.
Awesome.
And thank you, Doc.
Oh, wow. I'm applying to you.